technique in your book. I'm just going to throw your paint light up here. Those subacute hamstring strains, a lot of inflammation, swelling in the area. Your text is showing the person here, they're going from from proximal to distal with the technique. I prefer to go from distal to proximal. One of the things I'm looking at with this is not just circulation. I'm also concerned too with the lymphatic system as well. The lymph nodes are in the groin. I'm working in that direction. When someone has a lot of swelling and they're in a weight-bearing position, their leg is dependent, the tissue tends to get pulled down the leg closer to the ankle or foot. I've even expanded this technique to include the calf as well and work up the leg toward the hip. Again, starting off light, and again, keeping hand contact. I like to work distal to proximal. And you gotta watch, he's got more hair than most of you ladies. So you definitely use the lubricant and try not to pull the hair out, because that's a good way to make someone not relax. It's a very simple technique. Again, we're not just working on muscle relaxation, we're stimulating the neurovascular system. We're trying to get the muscle to relax. I told Phil I'd work in a word during the lecture. So I think anytime we're touching someone, the one common thing we do in physical therapy, as we study the physiology of the system, a muscle oftentimes is in spasm or guarding, because the body is telling itself to inhibit or stop certain movements because it's going to cause further damage to itself. And we're going in with the soft tissue techniques, telling the muscle to relax. What we're actually doing is those mechanoreceptors in the periphery, we're stimulating those. We hit that secondary motor neuron with the spinal cord, right? And they go through the cortex. So those signals from the brain going down, telling the muscle to spasm, stop, prevent movement. We're telling it it's okay to move again, and that the tissue may not be so bad. Because we want to, if we get someone subacute and we desensitize the system early on, we can oftentimes prevent secondary issues and chronic pain down the road, because the nervous system gets centrally sensitized. So sometimes as an early intervention, you can use this to kind of counteract some of those techniques. And some of the, I guess it's the quality of just having a simple hamstring straight, and make sure that the hair's lined up when you're done. There's nothing worse than winding the hallway in your hamstring hairs.